It's another disease we associate with growing older. But what is it exactly? So according to the Mayo Clinic, it is essentially a bone disease which is the result of a decrease of bone mass or a change of quality and structure in the bone. And this leads to a decrease in bone strength as well as an increased risk of fractures in people with osteoporosis. It affects men and women, although it is more associated with women, especially Asian and Caucasian women who are postmenopausal, usually around the age after 50. So it's considered a silent disease because the symptoms do not often present itself, and typically there are no symptoms. And the osteoporosis is often diagnosed only after someone has broken a bone, especially if they are older. Some symptoms that may present itself include back pain caused by a fractured or collapsed vertebra. We'll get into that later. Loss of height over time, as well as stooped posture. So first of all, what causes osteoporosis? Well, the bone is living tissue, and as living tissue, it is constantly broken down and replaced throughout our life. So when we are young, the creation of new bone tissue is actually much faster than the removal of old bone tissue. Therefore, we have increased bone mass, and so we become bigger. By our early 20s, this process slows down, and among most people, 30 is considered to be the age where the bone mass peaks. And osteoporosis occurs when the creation of the new bone does not keep up with the loss of old bone, meaning that you still have a lot of old bone in you and it's not being replaced fast enough with newer, stronger bones. So some risk factors or things that will increase your likelihood of developing osteoporosis is actually based on how much bone mass you obtained in your youth. So factors such as genetics and ethnicity, your sex, your age, your body frame size, and hormones, diet, and other medications that you took as you were when you were young will affect how much bone mass you obtained when you're young. And then therefore when you become older, when this bone mass slows down, when the replacement of this bone mass slows down, it depends how much you have in the bank, so to speak. So as I mentioned, with sex, women are more likely to develop osteoporosis. People with a smaller frame size, because they have a smaller body frame size, they are at a higher risk of lowering their bone mass because they have less of it to begin with. If you have hormone imbalances within your body, especially sex hormones such as testosterone or estrogen, due either to genetics, where you are predispositioned to have a lower level to begin with, or through illness. For people who have gone through breast cancer or prostate cancer and they take medicine which actually reduces the sex hormones, can also be at a higher risk of developing osteoporosis later in life. Your diet, if you had a lowered calcium intake, or maybe you might have an eating disorder or gastrointestinal issues, anything that would have affected the absorption of calcium, long-term use of steroids and other medications, so steroids such as prednisone and cortisone for skin conditions. It's thought that they interfere with the bone rebuilding process, as well as some medications which are used to treat or prevent seizures, gastric reflux, cancer, and transplant rejection as well. And not just that, if you have a pre-existing medical condition such as celiac disease, the disease where your body cannot process gluten, inflammatory bowel disease, cancer, multiple myeloma, or rheumatoid arthritis, you are also at an increased risk of developing osteoporosis. And lastly, which is very, as we know, with a lot of NCDs, we have lifestyle. And lifestyle, even as you're young, if you continue that, it can also increase your risk of osteoporosis. So things like sedentary lifestyle, excessive alcohol consumption, meaning that you regularly consume more than two drinks a day, or if you smoke, it can also increase your risk of osteoporosis. So why are we so concerned with this particular bone disease? Well, obviously with any kind of non-communicable disease, there are complications. So one of the major ones, which we are familiar with, are hip fractures. So hip fractures are usually obviously the result of a fall and the weakened bone. But the thing with hip fractures is that for older people, it can result in disability or even increase the risk of death within the first year after injury. The second complication would be a spine fracture, where you have a spine which is made up of several parts, several vertebrae. And the thing with a spine fracture is that it can actually occur even without a fall. And it's because the vertebrae, the bone, has been weakened to the point where it collapses, resulting in back pain, loss of height, or a hunched forward posture. So you would definitely need to, if you have an older family member or friend, you might want to observe them and see if they have any of these symptoms, because it could be the result of collapsed spine vertebrae. Obviously, you have to take them to a doctor first to get it diagnosed and confirmed. So now that we've talked about osteoporosis, what is it, and what are some complications that can result from osteoporosis, how can we prevent it? Well, as we mentioned, it's due to a loss of bone mass and the body's inability to replace bone mass faster than it is broken down. So the best way to combat this is to make sure you have enough stored in the bank to begin with. Obviously, if you are female or you have a family history of osteoporosis, this is a bit harder, but you know that you will want to do as much as you can to prevent osteoporosis from happening earlier on in life, because when it comes, sometimes you can't do anything about it. So moving on, prevention. First, you would want to make sure you have sufficient calcium intake. So the recommendation for men and women between the ages of 18 and 50 years old is 1,000 milligrams of calcium per day, or for elderly people, men who are 70 and women who are 50, because as we know, women are more likely to develop osteoporosis due to the reduced levels of estrogen after menopause, 1,200 milligrams of calcium per day. Some sources we can get from a diet include low-fat dairy products, dark green leafy vegetables, canned fish with bones, so fish like sardines or mackerel or salmon, some soy products such as tofu, as well as calcium supplements. As always, if you are thinking of including supplements into your diet, check with your doctor, see that there are no that it will not interfere with any prior medication that you may be taking. And just do be aware when you take calcium supplements, too much of them can be they have been associated with the development of kidney stones. And if anyone you know has developed kidney stones before, they will tell you that they are very painful. So you would like to not develop one. So if you want to take a supplement, number one, check with your doctor. Number two, check with your doctor about the dose. Although it is thought that people over 50 should take no more than 2,000 milligrams per day. But obviously, check with your doctor, confirm how much is the right amount. The next source is vitamin D, which is a vitamin that our body can produce through exposure to the sun through our skin. You can also get vitamin D from your diet, from foods such as cod liver, trout or salmon, so fatty fish, as well as milk. And you can also get it through supplements as well if you are in a place which has limited sunlight, or if you are housebound where you can't actually go outside very often, then you might want to also consider a supplement. And the last point of prevention is exercise. So it may sound counterproductive for exercise to prevent loss of bone mass, but exercise actually does help to build strong bones and slow bone loss. And this can be done through 3 types of exercise. The first being strength training, which can increase the arm and upper back muscle and bone strength. Weight-bearing exercises like walking, jogging, running, skipping rope, they can help improve your muscle and bone mass for your legs, hips, and lower back. And finally, balance exercises to help you reduce the risk of falling, especially as you grow older. So exercises like Tai Chi and anything that would help you to improve your balance. So that is all for today.